the monthly Oration lecture conducted by HAMT for the first time going online due to lockdown. Thank you.
We will start the proceedings with Dr. Mansoor Ali, who is the professor at the Government Homeopathic Medical College, Calicut. He is known for his teaching skills and also for his website homeobook.com and platform for information on homeopathy and is a fountain for our profession. He has conducted many workshops for young teachers and professionals all over the country. He is an approved practitioner by Ministry of Health at UAE.
This era may be called as pre and post-COVID era. According to WHO, the disease may last 4 years. So we need to live with the corona, adapt with the situations, need an action plan and a coordinated effort to survive in the near future. And we need some major changes in the homeopathic medical education. That means the implementation of technology in homeopathy that is required. And the CME programs, online clinical seminars are going on across India successfully. Regarding the clinical practice, we need to develop the concept of online consultation. We need to support the new generation practitioners with the marketing strategy as per the current needs. Effectiveness of homeopathy prophylaxis is tested, but need more clinical and scientific validation. An effective, evidence-based, multidisciplinary strategy is needed. So first I would like to discuss something about the lady doctors in this homeopathic sector. What happened to the female doctors? And in the last few years, more women doctors graduated from Homeopathy Medical College than men. But that was not reflected in the number of practicing doctors. So dear girls, I have no idea where you are or would be after the marriage. But after the glitters of married life fades away in 6 months or 1 year, you will start feeling the need of practice, what you learned. Strange place with no one to guide, where you don't even know if homeopathy exists. Where you don't know even the homeopathy exists. A kind of insecurity. That is marketing executive of the footwear company. That means there will be an opportunity everywhere. Now, secondly, we will discuss something about the private practice. Private practice is the best option than any other job that give you more social reputation and financial stability. And nowadays, it is challenging to start a homeopathy practice today. But if young doctors want to become successful, they need to start thinking themselves in a different way, who can utilize the technology far more cleverly than established doctors in order to attract more patients. And I would like to give some statistics related to the need of an online platform. 72% of the internet users, they looked online for health information within the past year. And 52% of the smartphone owners have used their phone to look up health or medical information. And 46% of the people go online for diagnosis of their illness or medical condition. And 10 million searches are taking place every month on Google to look for medical professionals. And remember one more thing, more than 1 crore of the Indian population consulted the homeopathy doctors online last year. Still a major area to cover. So implement the hair hostess philosophy in designing your clinic. Hair hostess doing the same nature of work as our housemaid, preparation of food, serving food, cleaning, etc. But the salary, social reputation, dress code are different. So start an attractive clinic that give more reputation to you and homeopathy. Patient will take your clinic surroundings, gatherings, clues about the quality of the care that they will receive. This will influence their confidence in the practice and their experience throughout their clinic visit. One area, that's a telemedicine, allows the homeopathy doctors to evaluate the diagnosis and treat the patient at a distance using telecommunication technology. The approach has been through a striking evolution in the last decade and it is becoming increasingly important part of Indian healthcare infrastructure. Through your social media pages, you can reach thousands of new potential patients. Ask the patients to have good experience at your hospital, to post a referral on your Facebook, Google and Twitter pages. Social media is all about interaction, so that more you can focus on your patients, the better. Tutor, that is also a great thing. People with a similar interest that you want to keep up with and sometimes have conversation with. And you have to place a listing on the local search engines such as Google Local, Yahoo Local and Bing Local. They are free but can be a tricky to worth it. And thirdly, we will discuss something about the homeopathic education. Can you imagine, as per the Central Council of Homeopathy syllabus, a student has to spend more than 5,000 hours inside the classroom during the BHMS course. Now the teachers and students must introspect whether we utilized these 5,000 hours in the classroom, inside the classroom effectively or not. And you had learned a lot from your college. Hereafter you will get opportunity to learn from eminent speakers through the CME programs. Since regular teachers are forced to lecture or teach on a prescribed syllabus. Completion of the syllabus is a major concern in homeopathy medical colleges. So a teacher can't deviate much. But one request, don't try a new method of prescription immediately after a seminar. You may be disappointed. Try to understand their methods through their books and cases. Their knowledge in the materia medica, repertory, and the case taking may be superior and different from us. And after reading the base book like Organon of Medicine, Materia Medica Pura, etc., only then explore the newer methods of prescription. These new teachers' methods or school of thoughts methods are tools that add to your armor and that they do not and cannot replace the basics of Hahnemannian homeopathy. Always remember. Now, always remember the organon is our user manual. If you want to utilize a gadget or instrument effectively, we have to read the user manual thoroughly. Similarly, if you want to get the concept of inner core of homeopathy, we must read every word of Hahnemann and the old masters many times over. Remember, many times over. Then you do not need any fancy ideas to do miracle cures than that of masters. And from the first day of homeopathy college, where you were introduced into your cadaver, you have entered countless lectures and lab hours, physical examination and sensitivity training sessions, and ward rounds or rotations under the watchful eye of teachers. Today, we will hold something that the people is privileged to sign behind their names as BHMS or MD. Still an ocean of knowledge to occur. We have to empty our cup because a full cup cannot accept anything more. Similarly, a person who believes that he had learned a lot cannot learn anything else and will stagnate quickly and not move to higher levels. And moreover, we are giving much importance to subjects like anatomy, surgery, gynecology, etc. during BHMS. But majority students, even after completing 5.5 years of BHMS course, don't know how to put a catheter, how to remove a catheter, or how to give an IV. But homeopathy students are well trained in this aspect in many of the colleges. We must have sound knowledge on the accessory management. These accessory managements are not the monopoly of any of the medical system but invention of science. We can send our patients for dialysis or physiotherapy. Homeopathy medicines along with the accessory management offers excellent results. But despite all these realities, there remain some wonderful aspects of homeopathic medicine. People still will look up to you. People will still respect you and say, people will trust you, confide in you and appreciate your efforts. You can do amazing things for the people. Be a part of your communities beyond your own workplace. We are also a part of society. I really appreciate the private practitioners because they are the backbone of homeopathy. Only 5% of the Indian homeopaths got a government job. Remember? The rest, more than 95% are at the private sector. We have to support them. They are in touch with the common man always than a teacher or a researcher in homeopathy. They get more social reputation and financial nurture than an academician or an administrator. But be on time in your clinic. Develop the essential habit of punctuality, for it is the most important for high success. Punctuality reflects the discipline and proper regard for others. Without it, even the most sophisticated person appears slightly offensive. Remember, the time is same to all. But some make it as a good time by using it in the right way. Some neglect it by wasting. Whether you go into the research, business, public service or education, prayer practice after your BHMS, Neither you nor the society can continue to survive or prosper simply by implementing what is already known. Somebody is going to have come up with meaningful new ideas, creative new approaches, and important new discoveries. And why can't that somebody be you? So come up with a new idea for the propagation and the prosperity of homeopathy. Homeopathy needs a revamp. And it is a high time for the new generation doctors to take up this enormous responsibility on their shoulders to carry the system forward. So we have to break the inertia because our attitude that determines the altitude. A small change in attitude makes a big difference. So we must have good vision, loyalty and dedication. Take homeopathy into greater heights. Now, fourth point, we will discuss something about the translational research, applying the knowledge from the basic biology and the clinical trials to public health needs. That means evidence-based medicines to sustainable solution for the public health problems. And there are three major obstacles to effective translational medicine. The first is the challenge of translating the basic science discoveries into clinical science. The second hurdle is the translation of clinical studies into the medical practice and healthcare policy. And the third obstacle is to effective translational medicine is also a philosophical thing. So, converting the molecular knowledge about a specific cancer cell into effective targeted therapies. So, the goal of translational research is to speed up the scientific discovery into patient and community benefit. So, move from the basic science discoveries to more quickly and efficiently into practice for the public health needs. That is also another area in homeopathy, the translational research that we have to think about in detail. Now, fifth point, the readers are leaders. You can't keep up with the new society and compete in the world of modern health requirements and information influx without learning anything new, without attaining updated knowledge. Read homeopathy books 100 times and you will still find something new every time you read. That's the peculiarity of our literatures. And that knowledge is the only wealth that no one can rob from you. Our brain is compared to an iron. The more it is used, the more it shines. And if not used, it rusts. It is only natural that memorizing power and the intelligence goes up the graph in those who read more and more as the life advances. Add only those who can survive in this field. Add only those who do so can survive in this field. And life should be filled up with hopes, goals and determination and optimism. All individuals who have attained highest levels in homeopathy practice generally cultivated the essential habit of optimism. Without optimism, life loses its luster and hardship appears at every step. Only those who fought against their limits have been able to find place in history of a man. The success achieved through one's own hard work and pride shine through. Remember the famous words of Swami Chinmayananda. You cannot get into the ocean without getting wet. And you cannot get into the fire without getting burned. So you must be able to leave behind your own trail of ideas and paradigm for this one medical science and for the society. Only then would your life hold some meaning and purpose. And after all, what is the point of living in life is like just another human on earth? Do something to mark your life. Do something to mark your life. The system or the society should remember that you have done something worth while you lived, even after your time. There is this extremely inspiring thought on Paulo Coelho, the famous novel in The Alchemist. When you want something, all the universe conspires in helping you to achieve it. We have our duties to the society, and in the midst of all these dreams and goals that shouldn't be forgotten, we learn at the expense of people's tax. You don't keep yourself away as if you are not a part of the community and society. As if you owe them nothing, there is need to be a part of the cultural, social welfare and the such events in the community we live in. And beware of being career-oriented youth, busily preoccupied with the selfish matters, who doesn't raise their voice for the fights or against vices, or without being conscientious regarding the social evil as an unnecessary dogmas. Now you embark your own journey landed with the purpose, and bear in mind the truth that you belong to those who are supposed to perform historical duty. You belongs to those who are supposed to perform historical duty with a strong sense of destination with regard to the survival and harmonious existence of the homeopathic medical science. You must have good vision, loyalty, and dedication. And always remember the famous words of Carol Dunham: give something to homeopathy, it will give you much more. Give something to homeopathy, it will give you much more. Our past diverge here, but let's keep the traveling through a path of passion and keep a smile in the store for those who might come your way and travels together. And that's all for the time being. Thank you.
Thank you, Dr. Mansoor Ali, for your generous tips to the students and young homeopaths and lady homeopaths, and also touching upon few challenges for our profession.